Here's Dave Steeren.
Well, when you're a member of the Dave Steeren Show entourage, you get the backstage pass, and so I don't usually fly small airplanes, but when I do, I prefer Reeve Airlines Alaska. And a friend of Reeve Airlines, Wendy Sellens, who is an author about a book that I find fascinating, first of all, because there's cleavage on the cover, and everything else is just everything else. Wendy Sellens, the book is titled Breast Cancer Boot Camp. Welcome to the Dave Steeren Show.
Thank you. Thank you so much for having me. I appreciate it.
So first of all, during the commercial break, you and I have decided that we are going to be honorary airship captains or passengers on board, because that's just awesome.
It was. I cannot believe the kismet of this, that right before the show he was on. And yes, I'm excited. And I attacked him downstairs. The poor man didn't have a chance.
Did you get a poster?
No, I didn't. I just got his card.
If you're nice, and I'm not saying you aren't, but if you're nice, maybe I'll share.
I can show you some beautiful pictures. Maybe I can.
Here we go. Here we go. Tell me a little bit about your book.
Okay. So this book is 43 years of evidence with the doctor that I studied with. He's a world-renowned breast thermologist and breast cancer surgeon. And what we show with the images in the book is that 80% of breast cancers are caused by estrogen. We show before and after pictures of several types of estrogen, including flax and soy. Mm-hmm. So what women may not realize is that breast cancer has increased 210% since 1970. And back in 1940, only 1 in 20 women had breast cancer.
Now, what is it diet that has been the catalyst for the increase in the frequency?
I believe it's the diet. And I believe it's the pharmaceuticals with the hormone replacement and estrogen replacement therapies.
So some of the treatments to deal with hormone replacement may be a catalyst for the generation of breast cancer.
I believe with our mothers. Now, I'm 43. With women my age, I believe it's the soy found in all processed foods, and it's the flax. And now my generation is doing what's called bioidentical estrogen. It's the new trendy thing, but it has the same results of the hormone replacement therapy.
The evolution of women's health is something that either becomes like a political football or when guys like me start to talk about it, then we get all flummoxed, first of all, because I have no medical background whatsoever. A little bit of background for me personally, my grandmother on my mother's side was diagnosed with breast cancer in the late 70s, had a double mastectomy, and it was one of those early breast cancer success stories. She passed away 2.5 decades later, not related to breast cancer, but just from age and other factors. Is the treatment changed?
No.
Really?
Mm-hmm. And that's the problem. And that's what Dr. Hobbins, he spent, in the 1960s, he started studying mammography. His close friend died of breast cancer. And he wanted to go into that research that was just starting then, and that was mammography. At the same time, thermography was also starting. So
now, what are the difference between the two?
Mammogram is an X-ray. Thermography is an infrared image of the breast. So you've seen the war movies. You see the little guy is in orange and red.
Running around.
Yeah,
yep.
All medical imaging comes from the military. So this was Dr. Ray Lawson actually invented thermography. He got the equipment. The Americans wouldn't sell him the equipment, so he went over to France and bought American equipment in France and started breast thermography. The first paper was written in 1956. So mammography and thermography came out at the same time. Mm-hmm. And mammography, you have to remember, that's not early detection. If you have a positive, if you have a positive mammogram, that means you probably have cancer. Whereas thermography, it screens women. So we can determine if you're at risk. So what I do is determine if you're at risk. Okay, look at these images. You look like you're at risk. So we're going to now treat you with preventative treatment. So that's what the whole book's about.
So basically, you have the indicators, or you have evidence that this may develop. Yeah. We're going to stop you before a lumpectomy or a mastectomy needs to be prescribed. Yeah. So we stop this in the very early neophyte stages of this.
Absolutely.
Now, people wake up one morning and they say, "This is my cause. This is what I believe in." What brought you to take such a keen interest in this?
It was a mistake. I fell into it. I went to, what's interesting is breast thermography's roots are firmly grounded in Anchorage, Alaska, West High. The inventor of the first ever infrared digital camera is a West High graduate of 1955.
See?
I graduated in 1988. So,
I don't believe that. You look far too young to be a graduate from 1988.
Thank you. What's interesting is he invented the first digital infrared camera. It was the first camera FDA approved for breast thermography. I went to graduate school, met my partner there, and this is his son. So I fell into it. Mm-hmm. So I started my business 6 years ago. Our interpreter is the best interpreter of the United States. He's the one that brought breast thermography.
Interpreter is what?
Breast thermologist.
Okay.
Yeah. He brought breast thermography to the United States in 1971. He imaged 100,000 women, did all the major studies, did all the major research on breast thermography, and that's who was interpreting ours. And then I started studying with him.
So tell us a little bit about the book, Breast Cancer Boot Camp.
What it is, what I do is very clearly explain what increases your risk for breast cancer. I have everything broken up into chapters, and then at the end, how to treat it. So I go through flax, soy, your hormones, the environmental estrogens that we find in all your hairsprays and lotions and the chemicals that we use on our foods, all of that. So I really show what's causing the increase, because it's not just like you said. It could be diet also. There could be women that aren't taking any hormone replacement or birth control pills, another thing, and then you see they have what we call vascular breasts. Mm-hmm. So, and then at the end of the chapter is Breast Cancer Boot Camp, and that's where I explain how to treat it. And I wrote the book for women in Alaska, for example, that don't have me to call on, and I try to make it very clear how to clean up your diet, how to go get hormone therapy, how to talk to your doctor. I have a chapter called Breast Cancers to Estrogen Lies, and a lot of women call me flustered and crying and upset because I tell them to go ask their doctor for this, their doctor yells at them, they come back and either cry or yell at me. Mm-hmm. So what I've done is take all the questions that they had and wrote the correct answer, because there's a lot of examples in there. Right, so this book is very easy for you to educate yourself.
I think we've had people who have fought various diseases. We've had Representative Mike Hawker in studio. He continues to fight, but as past, he should be dead, and yet he's going to show up in Juneau in January and be a gigantic pain in the ass to Juneau Democrats down there. And one of the things that both him and his wife said, and it's common for people who are either family members or dealing with cancer of any type, is I became a better patient when I became an informed patient. When I was able to push back and be an advocate for myself, as opposed to just sit there and digest what I was being told by my medical care provider. Not that they were wrong, not that they were bad.
Exactly.
But I didn't know enough about the disease to ask the questions I should have asked.
Thank you. That is the tone of my entire book, is educating everyone on what estrogen receptor positive breast cancer. Now, this is only 80% of breast cancers. 20% are not hormone related. I'm talking about the 80% are. It's 80% of breast cancers are preventable if you are given the information on how to do that. And even I actually consult a lot of women who have just been diagnosed with breast cancer to give them alternatives to treatment so they don't have to get a lumpectomy or a mastectomy.
Well, that's fantastic.
It's a very aggressive. Dr. Hobbins, he's a surgeon, he's like, why would you cut off the breast for a local problem?
Right.
If it was just in one quadrant.
Well, I think one of the things that I'm excited about with the book, and of course is one of the arguments that's been made in the medical profession is that women, by and large, have been treated, women's health issues have been treated as second-class citizens. And in family members and friends who have dealt with cancer or other illnesses, I can see that.
Yeah.
I can see that there are many physicians who are extremely empathetic, sympathetic, and dedicated to the cause of women's health, but by and large in society, I'm a huge fan of yellow bands and the cancer walks and the relays for life and that, because I think we're starting to get, hey, we're on the cusp of really turning the tide on some of these major health issues. And I'm glad to see that a local gal wrote such a positive, impactful book. Now, where can folks get a copy of this? Because you're going to have a book signing tomorrow.
Yeah, I am having a book signing at the Dark Horse from 1 to 3 tomorrow, Saturday. They can go to my website, the Women's Academy of Breast Thermography.com, and you can link it there, or you can get it on Amazon.
Wendy Sellens, class of 88.
Yeah, West High.
West High, thank you so much for coming by.
Thank you. I appreciate your time.
Absolutely. You're listening to The Dave Steeren Show on KFQD.